Hi, and welcome back to our mini mental health trainings. Today I'm going to be talking about trauma and trauma-informed care. We'll define trauma, understand the concept of universal assumption, talk about the impact of trauma, and also how COVID-19 may affect trauma. Trauma is a result of an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening, and that has lasting adverse effects on the individual. The individual's functioning and physical, social, emotional, or spiritual well being. To simplify it, trauma can be broken down into three E's: the event, how someone experiences that event, and what effect it has on the individual. It's important to remember that individuals may experience the same event, but how people experience it and the effect it has on someone afterwards can differ. So, events may be traumatic to some, but not to others. Here are some events that can be considered traumatic: natural disasters, physical assault, sexual assault, witness to a dead body, threat or injury to a family or close friend, work exposure, wartime, combat, bullying, potential exposure based on community, living in a home environment where someone has a significant mental illness, neglect, incarcerated household member, parental separation or divorce, drug use in the household. Something to keep in mind is chronicity matters, meaning the more traumatic experiences someone has, the more likely they are to have negative effects. So why should we care about trauma? It's estimated that 89.7% of the general population has experienced a traumatic event. That percentage is even higher in individuals that have mental health concerns at 94%. I'll talk more about PTSD, but just because 89% of the population has experienced a traumatic event does not mean they will all meet the criteria for PTSD. But it is important to remember that a very large amount of the general population has experienced a traumatic event and may have some trauma or trauma symptoms associated with it. Universal assumption of trauma is the same as the way you're trained to treat blood and liquids. So you're trained to assume that all blood is infectious and you should treat it that way when you come across it. Since the prevalence of trauma is so high, you should treat everyone like they have experienced trauma. Using trauma-informed communication on every person will keep everything consistent, and no matter if someone has trauma or not, it will help you build the rapport and the connection with somebody. First, realizing how prevalent trauma is and how many individuals have it. Next, recognize the signs and symptoms of trauma. And finally, respond with empathy. When communicating with individuals, recognize the way you phrase questions can make a big difference. Asking, "What is wrong with you?" can come off as not helpful and blaming the person. Instead, ask things like, "What happened to you?" It shows interest and compassion. PTSD, or post-traumatic stress disorder, is a lot of the times associated with veterans. While veterans are one group who have a high risk for PTSD, any individual who has exposure to a critical incident or traumatic event is at risk for PTSD. PTSD can include re-experience of the event through upsetting memories, nightmares, flashbacks, emotional distress, and physical reactions. Someone with PTSD may avoid reminders of the event, such as location or similar situation that they associate with the event. An individual can also experience some negative symptoms, such as the ability to recall key features of the event, which is important to remember because when you're interviewing someone who's just been in a traumatic incident, they may not be able to recall key features of the event, and that is because it goes along with the trauma. Negative thoughts, blame, decreased interest in things, feeling isolated, and difficulty experiencing positive events. When talking to someone who has PTSD, make sure to slow down and observe what's going on. Listen to the individual with respect and empathy. If you come across someone experiencing a flashback, make sure to give them space. Don't force them to talk about the distressing event, and gently reorient them. Say you're in your backyard now, or you're here, just gently reorient them to where they are. Ask questions such as, "Are you okay? What happened to you? And how can I help?" It shows that you care and you're there to help them. COVID-19 can be viewed as traumatic to some individuals. It is a threat to our lives and people that we know. Individuals could be experiencing trauma either vicariously through media or others. They also could be experiencing trauma directly through becoming sick themselves, the isolation, or someone close to them becoming sick. Frontline providers also are at a higher risk of trauma during these times. If you come across someone who's experiencing trauma or has experienced trauma, here are some suggestions to help cope with the trauma. Use strategies to reduce stress, such as breathing exercises, meditation, physical activities, and reaching out to social supports. It's important to be able to recognize the trauma and the symptoms and the triggers that go along with it. So if someone has PTSD or has had a traumatic incident, maybe for a while avoiding that place that it happened, or recognizing that they do have trauma and what their triggers are associated and what the trauma did to them. Finally, understand that large-scale traumatic events like COVID-19, sometimes support groups may be helpful to be around other people who have experienced the same similar kind of trauma. So if someone is talking about, COVID-19 and how it was traumatic or something happened to them, that was traumatic because of it, telling them that maybe finding a support group or something can help with that. Thank you for watching, and feel free to reach out to me with any questions you may have.